So a lot of great things to use Botox for. But what about the bad? Well, there are a handful of bad things, and one of those things is that it's paralyzing things, so things drop, things droop. So, for instance, there's always, like I mentioned, there's always some tone in our muscles that are just holding on. Now, what if somebody has some wrinkles up here, but that's their normal, and you try to get rid of that? And a provider comes along and says, "Oh, let's just Botox those wrinkles." Well, what you realize when you Botox this area, what's going to happen to my eyebrows? It's going to drop from here. It's going to drop to here. And it's dropped a couple millimeters just because we relax those muscles. Sometimes you don't want to relax those muscles. Yeah, there might be some wrinkles there, but in exchange for getting rid of those wrinkles, you just lowered the eyebrows by a couple millimeters. And for somebody who needs that, or they have loose skin in other areas, they're trying to hold it off their eyes. And if you start to drop that, suddenly you have things hooding over their eyes, and is not a good look, especially on a female face. If you lower the brows and the eyelids go over the eyes, that does not look good for a feminine face. For men, maybe you can get away with a little bit of that, but it's not. People are not happy when that happens. So overdoing Botox, you cause a droop or drop. Or Botox could be in the wrong place, and then you have something that's dropping down in the wrong place. So you don't want to do that. Some people overdo Botox in this area. It ends up affecting the muscles that are for your smile, that needs to lift up your cheeks, and suddenly you can't move your face correctly, and it's a different way. And it's not moving in a way that's natural. So those are bad things that could happen with Botox. But basically, that's the main issue, being over paralyzed. Something else is that, it's not that it's bad about Botox, but if you think it's trying to use it for the wrong thing, you think that, oh, this will help with skin rejuvenation, that somehow it's going to change my skin. It's not going to change your skin. Skin is still the same. It doesn't build new collagen in your skin. It doesn't make it healthier or bring elasticity or hydration to your skin. It's not doing that. It's just paralyzing muscles underneath. So that's not what it's for. So anyway, one of the things you want to understand is Botox can be used in a great way, but it's got to be used in balance with other treatments if you're really trying to do skin rejuvenation. It does help prevent things. That's one thing that it does pretty well. It's preventative. And in preventative what? Well, it's protecting your skin from you doing this to it. If you relax this area and you can't wrinkle it, it's protecting your skin from doing this or this. And when I say protecting, meaning that movement, when you push the skin together and it creases and it folds, you're creating creases in it, and that crease starts deepening. It's like a card, like a greeting card that has been scored down the middle so that it always folds in the same spot. Or back when we used medical charts, your chart would fold in the middle there, and it's been scored, and that cardboard would fold and open. And if somebody came to our office a lot, we open and close that chart a lot. Eventually, that spine where it's been scored breaks apart, and we have to get a new chart. And we keep replacing these charts. Your skin is kind of like that. If we keep folding it over and over and over and over and over, we start deepening that line. It starts being scored deeper and deeper, to a point where it's super thin there, where the skin has a certain thickness to it, then right at the wrinkle, it's become really thin, and then it's thick again, and it always folds in that line. So what we want to do is help prevent that. And one of those ways is identifying a place on your face that there's just too much movement, where it's over dynamic. You want dynamic movement, but you just want to overdo it. Everybody moves their forehead or their frown lines, their glabella, which is right here, naturally. But if you overdo it, some people are just really strong at doing that, then maybe it's a good time to get some Botox. It's a good indication to do Botox, because over time you're going to have a deepened, ingrained line there that Botox won't get rid of. These lines will get ingrained, and you can't get rid of it by using Botox. We do have treatments for that. PRP, we have our new fractional ultrasound device that remodels skin, all these things that help rebuild collagen. But if you want to prevent that aging, Botox has its place. Now, people complain and say, but it's temporary. You have to keep redoing it. I don't want to get addicted to it. Well, you don't get addicted to Botox. It's not that you become dependent on it, but you recognize the benefit of it, and then you want to continue. So I like to compare it in a way to sunscreen. And as we all know, hopefully now, that sunscreen does protect your skin from the damaging effects of the sun. So ultraviolet rays coming from the sun want to damage your skin. If you have no sunscreen on, you go out, the UV rays are damaging your skin. Collagen's being decreased. It's being broken down. It's getting older and it's going downhill. Now, when you put sunscreen on, it helps. It helps to prevent that, or at least minimize it. But it's not permanent. You have to keep reapplying the sunscreen. It goes away. You have to keep doing it over and over. You don't get addicted to it, but you realize the benefit of using the sunscreen, because somebody who uses sunscreen for most of their life compared to somebody who does not is going to look very, very, very different, right? There's a picture of a truck driver who was just never wore sunscreen, and he just drove. Left side of his face was so aged, wrinkled, and damaged, and his right side of the face was actually a lot better. But it's not because he put something on one side or the other. It's just because the left side of his face, the sun coming in from the left side of the window, because in the United States we sit on the left side of the car, so we're exposing our left side of our face to the sun, and it ages it. So it makes a huge difference. So that sun damage is always happening unless you protect it. Well, Botox works similarly to the sunscreen. It's not blocking UV rays, of course, but in the fact that it is temporary, you have to keep reapplying it, or in this case, re-injecting it, but not every day. You can do it 3, 4, 5, 6 months apart, and it'll still be very useful. You have to use it again, but when you have it on board, when you have it on, should we say, it's benefiting you. It's preventing you from that damage, from that repetitive creasing of that skin. You're creasing it over and over and over, hundreds, 1,000 times a day, over and over, 365 days a year. But if you have the Botox on board, maybe it works for about 3 months. Maybe you only do it twice a year. So for 6 months, you're not doing all of this. Instead of 365 days of creasing and creasing, you end up just creasing it 180 days or so out of each year. So Botox can be useful for that. It is useful for preventing the ingraining of these lines and wrinkles into your face. So that is something that I wanted to share. At RejuvaYou, again, we want to do this thing in a balanced way. And so we have to look at your face and say, let's not just overdo this Botox, because you're going to find plenty of practitioners out there who use Botox and fillers as their end all. I mean, the one thing that helps everything, and more the better. And the fact is, if they're pushing it more because there really is not much of a profit in Botox. But if they push it up very high doses and a lot of units, then they start extracting a big profit off of it. For us, Botox is not meant for that purpose. It is just something to support what we do, which is restore, rejuvenate skin. You'll look in my other videos about skin rejuvenation. There are things that actually cause you to have improved collagen. Make the skin behave at a younger state by improving its DNA gene expression to a younger state, where it becomes more hydrated and better immune function. The architecture of the skin actually improves and becomes like your younger skin again. Not an altered skin, but actually improves itself, restores itself. But you want to protect that. Now that you have improved it, we use this Botox to maintain the benefit that we've given you, as well as some of the benefits I've just described in this video. There's actually a way to use Botox in a conservative way, where we don't have to use as many units. The FDA had approved Botox, for instance, in this frown area, that 20 units was a good amount to use. And they said 20 units is a great amount. Well, we found that 20 units could be a little bit too paralyzing for a lot of people. And that in fact, dropping to maybe 20% less might be a better dose for you. So that requires a skilled eye in examining the patient and looking at what you need, and then finding out and then starting at a more conservative dose. In medicine, that's what we always do. You don't just give somebody a high dose of a blood pressure medicine or a diabetes medicine just because you want to. You start at a lower amount using your best judgment, and then they come back and maybe they need to increase the dose a little bit. But let's not just start out and blast them with a high dose, because that can have its own problems as well. So we don't ever want to do that. We'd rather you save your money from your Botox if you don't have to use that much, and use it towards things that are restoring skin, that are rejuvenating it, and other preventative things. And just do it the right way. Practice medicine still. So again, we love to restore lives. We are trying to renew the real you. We're trying to give back what you've lost, which was what's been stolen from you with time, which kind of snuck up and just taken it from you. And that's what we do here. Botox has its place, Botox is not bad. Botox is great for what it's supposed to do. Is something better than Botox? No, Botox is great for what it's meant for. But use the right tool for the right purpose. And that's in everything that we do. Use the right tool. Understand how to use it. Use the right tool. And that's what we're going to do for you. So look forward to meeting you one day. And we'd love to be able to share with you how our approach and our philosophy will work in helping you with your rejuvenation and maintenance needs. All right? So take care, be well, and God bless.